So listen, another moment from Sanders' Fox News town hall meeting that's getting a lot of attention is when he was asked about Medicare for All. So let's take a listen.
I want to ask the audience a question. If you could raise your hand here. A show of hands of how many people get their insurance from work, private insurance, right now. How many get it from private insurance? Okay. Now, of those, how many are willing to transition to what the senator says, a government-run system? There's 180 million people on private insurance.
All right, let's deal with that, Brett.
And
fair question.
They
Brett?
would be lost, right?
Well,
to your
Brett,
system.
Fair
okay.
question.
Okay.
Good question.
Good, thank you.
I know it's what the right wing throws out, so let me answer it. All right? Millions of people every single year lose their health insurance. You know why? They get fired or they quit and they go to another employer. I was the mayor for 8 years. You know what I did? What probably every mayor in America does? Is you look around for the best insurance program, the most cost-effective insurance. You change insurance. Every year, millions of workers wake up in the morning and their employer has changed the insurance that they have. Maybe they like the doctors. People are nodding their heads. Okay? So this is not new. Every year. Now, what we're talking about actually is stability. That when you have a Medicare for All, it is there now and it will be there in the future.
All right, so he's getting some applause there. Was that a turning point in the town hall for him?
Well, what was interesting is they had made clear that this wasn't just a room packed with Democrats, that there were Democrats, Republicans, independents, and self-professed Democratic socialists in the room. They didn't give us the specific breakdown, but if you thought that he was in front of an entirely friendly audience, he wasn't. And you saw there that about half the room agreed with him that perhaps this system would work. Look, he's done a very good job in the last week since he formally reintroduced the Medicare for All plan of making that argument that you might like your private insurance, but what's to say that every fall when open enrollment season begins, your employer doesn't tell you, actually, we've changed it up again this year, and you had no say in that. His argument is, what I'm proposing would be more stable, would be more predictable, would cost less ultimately, because while taxes might go up, and he acknowledged that that's a possibility, you wouldn't have people paying deductibles or out of pocket for some of their medical insurance or their medical needs. We'll see where this goes, but as Sanders likes to point out, 4 years ago this was a radical, out of left field idea, and now it's co-sponsored by many of the people who are running against him for president.